Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Vashe Solution. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So Vashe is a skin and wound cleanser that is containing 0.033 hypochloric acid, which is a non-irritating, non-sensitizing, non-mutagenic, and through the natural zone technology, it does meet the upper range of normal skin pH, so 5.1 to 5.5. Hypochlorous acid is a broad-spectrum chlorine-based antimicrobial which has been shown in vitro against bacteria, fungus, spores, viruses, and the kill time for most organisms is 15 seconds. This solution can also disrupt biofilms, and it can be used in combination with other debridement methods. So your autolytic, your enzymatic, your mechanical Shark's debridement. What it cannot be used with is maggot therapy debridement. Okay, we cannot use it with that. And it can be used as a soak or as a wound packing. Okay, and it can be used as a negative pressure wound therapy solution. In the presence of blood, it can turn a green-light color due to the reaction between the hypochlorous acid and the hemoglobin. It is safe to use on tendons, ligaments, cartilage, and bone. It's safe to use around the eyes, ears, and genitalia. And it is safe for the pediatric population, including neonatals. So Vashe Solution is to be used under the direct order of an endoswas or wound care clinician, and it may be used for wounds, first, second degree burns, grafts, donor sites, peri-tube drain sites, where normal saline isn't going to be as much effective for removing the debris, the slough, necrotic tissue, for wounds that have signs and symptoms of infection or biofilm and has a odor present. Precautions. So if PHMB gauze is being used after, you want to rinse out the wound first with normal saline after the Vashe, because the two antiseptics, it can slightly diminish the effectiveness of the PHMB. So you want to make sure you cleanse it really well, flush that wound out, and then kind of pat it dry, flush it again. You just don't want the two mixing, and that goes pretty much for all antimicrobials. You only want to be using one at a time, okay? That is your safest bet, not to be mixing them. Contraindications, so we're not going to use for clients who have a sensitivity to hypochloric acid, and we're not going to use with maggot therapy. So how do we use the Vashe wash? So first we're going to make sure that we're labeling the bottle because this is going to be for multi-uses, and you want to make sure that you're keeping that bottle as sterile as possible, okay? So for wound cleansing, we're going to wet a gauze with the solution, wring out any extra, and apply it to the undermining sinus, tunnels, and wound bed, allowing a soak time of 3 to 5 minutes for biofilms and scant to light amount of slough, and 5 to 10 minutes for moderate to heavy amount of slough necrotic tissue. Okay, so once that time is up, you're going to remove the compress, cleanse the wound and peri-wound with the solution. Unless you're using the PHMB, okay, you would use the solution and then the saline after. But for this case, we use the solution and we're going to firmly but gently remove as much slough and necrotic tissue with a gauze as we can. You're then going to pat the wound dry of any excess solution, dry the peri-wound skin, and dress the wound with appropriate packing, wound filler, and then apply a cover dressing that is going to maintain a moisture balance for 24 hours because this is something that we do use daily. So you want that moisture balanced wound for 24 hours, okay? If you're not using PHMB, You do not have to rinse this solution off with normal saline, okay? So now if we're using this solution on a packing, you're first going to cleanse the wound and peri-wound with this solution, okay? And you're going to gently but firmly try to cleanse it, remove it with a gauze, any of that sloughed necrotic tissue. So we're trying to get rid of as much of that as possible. And then you're going to soak a plain ribbon packing gauze with the solution, wring out any excess, and you're just going to gently pack any undermining tunnels, the whole wound cavity, and then just pat the peri-wound dry and apply an absorbent cover dressing to maintain a 12 to 24-hour moisture balance wound. So sometimes this is ordered as a daily or twice daily, so just completely depends on the order. And we just want a cover dressing that maintains that moisture, okay? For peri-wound drains or tube skin cleansing, we're going to cleanse the peri-wound, the peri-drain slash tube skin with a 2x2 soaked in solution, and you're just then going to pat it dry, okay? And then apply the appropriate cover dressing over that tube or drain. So the frequency of dressing change. So this is used daily for cleansing. For packing or wound filler, it can be daily or twice daily. Completely depends on the order. We just want to make sure that that is not drying out in between dressing changes. The expected outcome is that it decreases the amount of debris, slough, necrotic tissue within 1 week. So we're noting a difference within 1 week, and signs and symptoms of local infection are resolved within 2 weeks. So that's all I have for this video. I hope it did help you in your daily practice, and if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated. And I will catch y'all in my next video. See you guys.